I'm here to interview Deborah Evans. Deborah is leading the national work for Healthy Living Pharmacy Pathfinders. Deborah, what is a Healthy Living Pharmacy?
Well, a Healthy Living Pharmacy is a pharmacy that's committed to supporting the health and well-being of the community they serve in a proactive way. So we're used to responding reactively to people's requests for things like stop smoking support, weight management, etc., or talking to people about their alcohol in addition to the way they take their medicines. But this is in a more proactive way. So a Healthy Living Pharmacy has that essence of proactivity about it, but there are a few other things that are important about a Healthy Living Pharmacy. They have a team that works together to offer that support to their community. So it's not all about the pharmacist in isolation having that capability. And they've also demonstrated consistent delivery of services, both from a quality point of view, but also productivity. So in other words, whatever the day of the week or the week in the year, the pharmacy is equipped to deliver services such as emergency hormonal contraception, stop smoking, etc., whatever they've been commissioned to deliver. But you could say many pharmacies do that anyway, so there are a few other things that a Healthy Living Pharmacy does. The first is that they have a person within the team who's achieved a particular qualification, and we call them a Healthy Living Champion. So they've got the Royal Society of Public Health Understanding Health Improvement Level 2 Award, which really recognises that they are qualified to talk to the public and give them brief advice. So it's not a sort of big complicated qualification, but it just puts a benchmark in place. Healthy Living Pharmacies have also got pharmacists and non-pharmacy managers who've taken some sort of leadership training to support skill mix within their team and some of the change that's required to change the way people work together. And finally, and this is probably the biggest difference, a Healthy Living Pharmacy is identifiable to the public and to other healthcare professionals through the use of a logo, a quality mark that demonstrates that that pharmacy has achieved both the quality criteria and the productivity levels that's expected of them.
So how did Healthy Living Pharmacies start, and why did they start?
Well, Healthy Living Pharmacy was a concept that really came out of some work that was happening in NHS Portsmouth. So an acknowledgement that there were some significant health inequalities. It is an area with some significant deprivation and alongside it issues that we recognise across the country: obesity, alcohol abuse, high levels of smoking, and these were leading to issues with long-term conditions and premature death. So really, with that as a backdrop and a recognition that pharmacy could offer so much more, the PCT, working very closely with Hampshire and Isle of Wight LPC, put together this concept of pharmacies being more proactive around health and wellbeing advice. Now, many pharmacies have done that for many years, and it's been in many strategy documents as well. And in fact, the white paper building on strengths, delivering the future, that had come out of the government and the Department of Health a couple of years ago, recognised pharmacies as being healthy living centres. So we were pushing against an open door, if you like, from a policy point of view. But really it was around understanding that community pharmacy could do so much more for the community it serves and give access to the public to services that they perhaps wouldn't otherwise recognise from pharmacy. We also did some work with the public in Portsmouth, and they told us a number of things which kind of opened our eyes to the perceptions of the public. So for example, they didn't see pharmacy as part of the NHS, they didn't understand the wealth of services that they could have access to, or the fact that pharmacies had a number of highly qualified team members, including of course the pharmacists, that could help them not just with medicines optimisation but also health and well-being. And finally, they didn't recognise pharmacies as places where they could get private and sensitive, private and confidential conversations, even though most pharmacies, and all of them in Portsmouth, have a consultation room.
So what does this mean for pharmacists and for their pharmacy teams?
Well, we've done some work with our teams in Portsmouth because we've had some outstanding results, and this has obviously influenced the interest across the country. And we actually spent some time talking to pharmacists and their teams within Portsmouth to find out what it actually meant to them. And there were a number of things that they told us. So the obvious things in terms of more engagement with their public and the community that they serve, as well as the ability to really engage with their team and develop their team. So it's been recognised as an organisational development tool. So in other words, a way of motivating and really involving the team in things that they perhaps wouldn't have been involved in before. We've also had pharmacy team members telling us that's improved footfall, loyalty, revenue, particularly from service-related income, as well as giving them an enhanced standing within the community and with other healthcare professionals. So it's improved their relationships with other providers of healthcare services in their area. And besides which, it seems to have joined up pharmacy across the whole area. So in Portsmouth, we genuinely feel that we've developed a community of community pharmacies.
So where are we now nationally, and how is it going to evolve in the coming weeks, months and years?
Well, the first part of that question is easier to answer than the second. As far as where we are now, all of the pharmacy bodies, and that included CPPE, so the Company Chemists Association, CPPE, PSNC, the MPA, and the Royal Pharmaceutical Society, working with the Department of Health, acknowledged that if we were going to really take forward the excellent work that had happened in Portsmouth and roll this out in other areas, we needed to have a coordinated approach. So first of all, those bodies have all got together and we've established a Pathfinder support programme, and that's basically to provide advice and support and resources to a number of areas, as well as recruiting a number of Pathfinders across the country. So we have 20 Pathfinder areas representing 30 PCTs, but there are also a number of areas across the country who are not Pathfinders who are also taking forward this programme. We know from our Pathfinders that we've got probably in the region of 350, if not more now, healthy living champions fully trained up across the country. A number of pharmacists, probably in excess of 250, have been through some formal leadership training to support going through a change in business model. And a number of other Pathfinders are pushing ahead with other aspects of training and support, including thinking about public communication campaigns. So that's the sort of first part of where we're up to now. But importantly, from a policy point of view, we need to answer the question, is this replicable in other areas across the country? And that's the key to this. We need to evaluate, can the results that were achieved in Portsmouth, which are quite impressive, I have to say, around things like stop smoking, alcohol interventions, respiratory MURs and other public health interventions, are they replicable in other areas of the country? We're confident the answer is yes, but of course we need the evidence to prove that. And that's where pharmacists and their teams are critical, because unless pharmacists and their teams can deliver the improvements in quality and productivity that we expect Healthy Living Pharmacy to achieve, as well as raising the awareness amongst the public, then Healthy Living Pharmacy hasn't got the future that I think it deserves.
So what can pharmacists be doing now to prepare and to take on this new mantle?
There's many things, and whether it's Healthy Living Pharmacy or any other model for delivering the future potential for community pharmacy, I think the answer's the same. And in fact, it's probably worth saying that Healthy Living Pharmacy is an excellent way of kind of wrapping everything up together and sort of really pulling together medicines optimisation in a healthy living environment. But it's not the end in itself, it's the means to the end, which is around pharmacists and their teams contributing more in terms of the public health agenda and the interventions that they can make. But whether it be Healthy Living Pharmacy or any other future direction that pharmacy is going in from this perspective, I think there are a number of things that they can be doing. The first is to take their head out of their individual pharmacies and start to look a bit more strategically what's happening in the environment, what's happening in their local environment, but more broadly as well. We know the NHS is under significant pressure, not just because of the global austerity that's happening at the moment, but because of the increase in long-term conditions and the fact that we're all living longer. That's putting a tremendous strain on the health service. So look at that, look at the local community, what the needs of the community are, and really start to think about what services are needed. But of course, and this is where it's particularly relevant to CPPE and continuing professional development, start to think about what sort of skills and knowledge the pharmacist and their team will need going forward. So how can you use the skills within your team, but also what new skills might you need in order to be able to deliver against this agenda? But also to think very carefully about whether this is the right business model for you as an individual and why you're actually engaging in it. Because of course we can have all the skills and knowledge in the world, but unless we're actually applying it because we want to and we're motivated to do so, then nothing will change. So I think that's an important aspect of this as well. And then really to talk to other healthcare professionals, engage with GPs and their teams, other providers, to really understand where the gaps are for them in healthcare provision and how we can help as pharmacists and teams to actually really meet the changing needs of the community that we all serve together.
Deborah, you mentioned CPPE a few times. How can CPPE help? How are they involved with Healthy Living Pharmacies?
Well, CPPE are involved from a strategic point of view, so supporting the Pathfinder programme, and we have CPPE represented on the Pathfinder support group, which contains representatives from the bodies I mentioned earlier. And so that helps us to see where CPPE can support with the programmes that they've already got, but also for CPPE to consider what future help and support might be needed. So for example, the programme of events that CPPE runs across the country on public health issues such as stop smoking and sexual health are available in addition for Pathfinder sites. So Pathfinder areas should talk to their local regional manager to find out more about that. But also non-Pathfinder sites can have access to a number of the programmes from CPPE to support whatever they're trying to do locally. So there's something for everybody in what CPPE offers, as well as, of course, some softer skills, distance learning packages that are available through CPPE.